Now, we've all been hearing a lot about the coronavirus, and you're probably wondering what that means to us here in Virginia and what it means for you and your family.
Our next guests are emergency physicians at hospitals in and around our area. They're joining us on behalf of the Virginia College of Emergency Physicians, or VASEP. We welcome Doctors Chris Hogan and Carlton Stadler to Virginia this morning. It's great to see you.
Thanks for having us.
This is an important conversation
Yeah.
pretty much everyone's having.
And thinking about, and some people are freaking out and others are like, But obviously this is a big deal. And I guess the first question is this a question of if Virginia's going to be affected or when? And go ahead, you're up first.
Yeah, you know, Bill, that is the big question. I will tell you that it is only if.
Okay.
Probably 3 weeks ago, I think now we're saying, when is it going to happen? I think it was an initial scare, but now we're moving into an area of where all of the emergency rooms are preparing for, when is this getting here?
How do the emergency rooms prepare for something like this? I think many of us are still wrapping our minds around what it is.
Well, it probably, it doesn't look much different than your usual virus that you get every year, which is fever and scratchy throat and feeling lousy. And we know to look for it, so we kind of expand the questions we ask when they show up in the emergency department, such as travel or, kind of things like that. So it's just a really bad virus that our immune systems haven't seen before. So, that just makes it a little bit more difficult.
So in training medical staff, I mean, these are people like first responders who run towards the emergency instead of away, and your staff has to be there. Are you guys going through some kind of special training, or are there hazmat suits involved, or what goes on with that?
Sure, no, great question. I think each of the emergency rooms in town, in fact, I can guarantee each of the emergency rooms in town have special procedures for, like Dr. Hogan mentioned, not only screening these patients, but bringing them into areas, asking the appropriate questions, putting them in specific areas for people with upper respiratory symptoms who screen positive for each of the risk factors for having this disease, being from mainland China or one of the epidemic areas. Each of the staff is also going through specific clothing and personal protective gear procedures, learning how to take it on, how to take it off, what special rooms are these patients going in, certainly hand washing precautions and things like that we continue to endorse.
What should folks know to be aware and maybe possibly even to protect themselves? I mean, when we have this conversation, you talk about coronavirus and then folks say, well, the flu can be just as, can we compare and contrast the two of those? I guess I asked you two questions. Maybe we start with that, coronavirus versus flu.
Yeah, let's, Chris, you want to start with coronavirus versus flu?
It's just a different kind of virus. So, like, the mainstay is just hand washing, and if you can't hand wash, then just use the gel wipes. And you don't have to, if you go out and about, just make sure you wash your hands. The other thing is, and I'm always guilty of, is touching your face. Even if you happen to just touch something, it has to be transmitted somewhere in this vicinity for you to actually get infected. So if you can do that, that's like 90% of the battle right there.
Right. When you came up today, I went to shake hands, and we did a little elbow
That's right,
bump.
this
is the new hello. Just throw an elbow
Maybe
over
a
there.
bow, right?
Yeah, we all shake hands a lot,
Sure
especially
do.
in our business too. We have all these guests and people that come in. People are trying to protect themselves, but let's say you think maybe you've got it, or the symptoms. I think you addressed this. It's kind of the same as the flu, the normal flu, and I'm always afraid to go into an emergency room to begin with,
Sure.
But you got to go when you got to go. But I'm sitting there with all these sick people. So if I'm going to the emergency room, am I going to wrap a towel around my head to keep from breathing in? Or how does that work? How do you protect yourself personally?
Great question. And Dr. Hogan mentioned hand washing being the central key to this. This is mostly transmitted through the air with droplets. And so unless you're sneezed on directly, you're running very low risk there. People are wearing masks all of the time now. I don't know that we necessarily endorse everybody wearing a mask. If you feel ill, then certainly wear a mask. So when you come to the emergency room, Bill, we're going to have masks for everybody that has those types of symptoms. But like Dr. Hogan said, washing your hands with a 60% alcohol-based solution in order to be able to get those clean prevents that transmission. This virus can live on inanimate surfaces for up to a week. And certainly touching those, and then again, like you said, touching your mouth or nose is certainly how this is transmitted.
How do you know when it is time to come in if you suspect maybe you have contracted the virus or maybe think you have it? How do you know when you're sick enough to come in and have this explored?
There's several risk factors that people have for having this virus. Certainly, like we mentioned, contact with mainland China or one of the epidemic areas that have been recognized. Certainly those that are immunocompromised, those that have the elderly, those that have chronic medical diseases or on medications that can lower their immune system are at increased risk. So really cough and cold type symptoms with those risk factors is a reason to seek treatment, whether it be your primary care and urgent care or eventually the emergency room if you think you need one.
Last quick question, Chris. Do local hospitals have test kits available now? Are we going to have them in the future? We've heard a lot about that.
They are coming online. The Virginia State Department of Health will have that assay. Usually we involve infectious disease specialists in figuring out who we want to do that test on, because you can't test everyone, otherwise everything gets overloaded. If you do have a scratchy throat or a cough, you're not going to be able to suss that out from just a regular old virus. So if you've got that, just out of respect for other people, particularly if you're with people who are sick or have comorbidities like emphysema or something, you should be wearing a mask, because you don't want to be spreading those droplets all over.
Thank you very much.
Thank you both very
Important
much.
stuff.
Throw a little elbow at that.
That's right.
Good to have you guys.
Appreciate
Appreciate it.
Okay. All right, folks, we thank the doctors for that important information about VASEP and resources. We'll post a link on our website, WTVR.com/VTM by early this afternoon.
Stay with us. We'll be right back after a quick break.